As a special guest, we have with us His Excellency Dr. Virander Paul, High Commissioner of India to Kenya and PR to UN Environment Programme and UN Habitat. I would request you, sir, to please come on screen and address our attendees.
Thank you. I hope you can see me on the screen.
Yes, we can.
Namaskar, Jumbo. Good afternoon, everyone. I bring you all greetings from the Indian High Commission in Nairobi. It's my pleasure to be with this India-Africa Vaccine Summit being co-hosted by NatHealth of India and Africa Healthcare Federation to examine certain key factors constraining Africa's ability to achieve the desired COVID vaccination levels and what could possibly be done, gaining from India's model and India's experience. Chairman Dr. Amit Thakkar, Dr. Harsh Mahajan, thank you so much for asking me to join such an impressive gathering of distinguished experts and leaders representing practically all areas of action. It is this action that determines the course and outcomes of what we discussed today. I would like to recognize with admiration the presence of all the senior experts and officials who are present in this virtual room from India, from Kenya, and also from other African countries. In this, what I would like to describe as a well-timed reflective dialogue, we are touching upon a range of topics: management of vaccination campaigns, policy making, technology, innovation, advocacy, resources, finance, vaccine development and manufacturing, supply chain challenges, vaccine access, vaccine hesitancy, vaccine equity, vaccine nationalism, vaccine internationalism, etc., etc., etc. And this wide range of themes makes this meeting ever more important. It's extremely satisfying to me as the Indian High Commissioner to see the African Health Federation and the Indian Health Federation joining hands, bringing together some prominent people who are dealing with their own hands, as they say, the challenge of the COVID-19 pandemic. How is the virus going to behave in the coming weeks and months? Where is this pandemic headed? How much more the world must suffer this agony? These are some of the questions that we hear every day. At the same time, we also hear from experts that the acute phase of the pandemic that was associated with large-scale deaths and hospitalizations might be ending this year. The virus itself is very unlikely to go away completely and will probably settle down into a pattern of transmission at low level, causing occasional outbreaks in under-vaccinated population. We hope that that is the end game here, but we are certainly not there yet. This is going to be a bumpy road on the way to low levels of COVID. The shared goal internationally is therefore to raise the level of preparedness to effectively deal with this challenge and also future threats of emerging and re-emerging infectious disease. I'm very glad to see in the program that many of these points would be discussed in much greater depth in various thematic presentations that will come up in a short while. The topic given to me is rather general. It is setting the stage for India-Africa collaboration in healthcare. In fact, a lot has been done already to build a successful tradition of healthcare collaboration between India and Africa. In other words, the stage has already been set. But what I seek to do in a few minutes that I have is to broadly recall where we come from and where we are headed together. Healthcare cooperation is embedded in our larger Africa policy, in which development cooperation, capacity building, training, education, healthcare, and all that we jointly agreed to do is aimed at Africa's sustained socioeconomic development. This is conducted largely in the South-South format. It's about shared goals and aspirations, and India's declared commitment to share our capacities and strengths with Africa. This approach has been, since India's independence, the foundation of the ties of friendship and partnership between India and Africa. This is driven by deep mutual understanding at the highest political levels and also sustained by the goodwill for each other at the people-to-people level as well. I am proud to say that relations with Africa constitutes a major direction of India's overall foreign policy. In this backdrop, practical cooperation with individual countries is aligned with the actual needs that need to be addressed in the mode of collaboration. India wants to be a steady partner in Africa's consistent growth and development towards higher levels of socioeconomic development. Now, coming to some specifics on the healthcare side. In the India-Kenya context, in recent years, one of the visible symbols of our cooperation is a state-of-the-art machine from India called Bhavatron, which has been treating cancer patients every day at Kenyatta National Hospital in Nairobi since 2017. It has considerably improved cancer treatment outcomes in Kenya. Another visible aspect is what is commonly known as medical tourism. What's the answer when our Kenyan friends look for world-class medical treatment by world-class doctors at cost that is fraction of what they would pay in the developed world? What's the answer? The answer is your search ends here. Look no further. India is the solution. India has been, as most of us living in Africa know, India has been a preferred destination for quality medical treatment. On similar lines, there are understandable expectations in Africa that India should be equally forthcoming in COVID-like situations as well. And this is what India has done since the onset of the pandemic. When supply chains are disrupted and demand outstrips supply, the most vulnerable will inevitably get hit the hardest. Even during the worst period of the pandemic that we have so far seen, India kept almost all its supply lines open, ensuring that critical medical equipment, medicines, and other supplies would reach the countries in need. India's reliability as a partner in these difficult times has been recognized around the world. Early last year, under India's Vaccine Maitri initiative, Vaccine Maitri is an expression in Hindi that means vaccine friendship. Kenya received 100,000 doses of Covishield from India. Covishield is the name given to made in India Oxford AstraZeneca. Separately, Kenya also received a little over 1 million doses of Covishield under the COVAX group. And all that stock helped Kenya initiate their COVID vaccination drive. We are happy that India has played a role in that process. In the early months of the pandemic, India had also supplied a consignment of medicines to treat COVID. A good number of Kenyan healthcare professionals and administrators have also benefited from online e-tech courses on COVID-19 organized by Government of India. As part of our specialized digital infrastructure, India has developed and extensively used COVID. Now, COVID, which stands for COVID Vaccine Intelligence Network, is an online platform for the management of large-scale vaccination program. India has offered COVID free of cost to all countries globally. Indian and Kenyan experts have already discussed and exchanged notes on various technical nuances of the COVID vaccination platform, and I am very happy that there is a standalone session dedicated to COVID that's going to come up as we go along this afternoon. Most recently, we have agreed on mutual recognition of COVID vaccination certificates issued by India and Kenya. We are also working to formalize an agreement, a bilateral agreement in the health sector to further structure and consolidate our collaboration. We are also looking at a greater use of traditional systems of medicine in both our countries. We have noted Kenya's plans and remarkable efforts to be self-reliant in vaccines, biological products, and pharmaceuticals through setting up manufacturing facilities in Kenya. India stands more than ready to join hands with Kenya to discuss new such areas using our rich past experience of working together on mutually helping basis. India's private sector is also keen to build more institution-to-institution linkages in healthcare, which we would encourage. Global preparedness is the key to dealing with the global challenges of today and tomorrow. It's not just the issue of vaccines alone that we are discussing today. It's about other things as well, such as essential drugs, including antiviral drugs, affordable and effective diagnostics, and devices and instrumentation that need to be reliably made available in low resource settings in developing countries. We do need low cost solutions driven by appropriate technologies in a genuine spirit of caring and sharing internationally. Before I conclude, let me say, and most experts would already know that in public health situations across the world, at different levels, in different settings, sometimes the last mile proves to be the hardest. And we are constantly learning. We have done so much together, and there is so much more to do. Thank you, and I wish this dialogue every success.